Welcome to What the Health? Where anything health is fair game as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan and Angela Turo.
Greetings, I am Dr. Dan here with my co-host,
Angela Turo of Turo Family Chiropractic.
Thank you for joining us today where we will be talking about inflammation in formation.
It's gonna be a good one. Gotta do the quick disclaimer. You guys know this. We're here for informational purposes. We're here to have a thought-provoking discussion about health, get you guys thinking. This is in no way intended to be individualized medical advice. So with that out of the way, information.
Oh, see, you
I said it right. I was so sure I was gonna trip that up.
So today, if you are a biochemist, if you are any sort of, molecular biologist, please, pathophysiologist, please don't be gritting your teeth, pulling your hair out. Maybe just skip this episode because we are going to keep this at a very 30,000 foot view for the layperson to be able to understand. And again, neither Angela nor myself are experts in the biochemical pathophysiology of inflammation. Yes, I had to learn it for boards at one time, and I understand a few classes. But this is not something that we are, absolute experts in. But we understand how to apply. Okay, again, as the clinicians, we understand and are the experts at how to apply the information and understand, how the biochemical pathway is impacting the body in terms of helping individuals get healthy and stay healthy. So I think one of the biggest misconceptions of inflammation that we want to bring up are, usually we think it's so bad. And, so I have to ask Angela, if I'm Joe Smith here asking you, hey, inflammation is bad. So, can I just take an anti-inflammatory every day and help control my inflammation?
Yeah, and that is a big thing where we hear about this. You hear about the anti-inflammatory diet. I talk about an anti-inflammatory lifestyle myself, but that's where it's really important to understand that there are different types of inflammation. So there is the acute localized type of inflammation that Dr. Dan's going to go into a little bit more detail here. And then there is the chronic systemic low-grade inflammation that is the result of an unhealthy lifestyle, that is a result of a lot of stressors. So that is really the big distinction. And that's what we're really talking about. One, yes, natural, healthy, good response. The other one is what becomes a problematic situation. So understanding that, and we will make sure that we're clarifying which type we're talking about when we're talking about inflammation. We're going to address both in this, but that is the biggest thing to understand is you can't just say good or bad. You have to understand what type of inflammation are you talking about.
Yeah. And please understand, again, the process is the same. The biochemical pathway of inflammation is the same. But I want to use the analogy. Okay. So we're here in southwestern Pennsylvania. There is plenty of moisture in the air and in the plants, the vegetation, almost year round. So I love to burn stuff. I love to have, campfires. I love to, maybe just take some boxes and burn some boxes to, help take them down to ash, which I think is a great way to recycle. Burning some boxes, maybe burning some vegetation that I cut down from landscaping, but whatever the case may be, having that very localized controlled burn because of the environment in southwestern Pennsylvania and the moisture that we have, I can do that very controlled burn in a very healthy, safe way with knowing that I am not going to cause a community-wide fire because of it getting out of control.
I can vouch for him. He has yet to burn the neighborhood or office down.
That's right. Eagle Scout history, very safe, safe when it comes to fire and making sure that we, have very, controlled, safe burning environment. So with that being said, if I took that same localized controlled fire and put it in a different environment, such as, out west, Colorado, California, you can take that same fire and put it in that environment, and very, very quickly, with a little bit of wind and the dryness that's out there, cause a statewide or multiple statewide, consuming fire that could damage, tens of thousands of residents and, displaced families and wildlife, and just can be very extremely devastating. So again, same fire, two situations. Mine, I can use it in a very controlled, healthy way, to help recycle. But the other way, in the other environment, completely out of control and can cause, some significant devastation. So when we're talking about inflammation, the body is designed to be inflamed, right? The body has this healing process. We talk about it's designed to heal. When the body has an injury, such as a cut, it is designed to inflame that area to basically help, to essentially help repair the wound. And so you learn, the 5 signs of inflammation, when you're, in your clinical classes. But basically, do you remember them, Angela? There's rubor. Oh my goodness, I should have had this written down. But rubor is redness. Okay, pallor is pain. You have, dolor is pain. You have swelling, and there was one more that I'm missing, and then heat. I'm sorry. There you go. Which I forget the Latin term for it. So anyway, but yeah. So you have heat. You have redness. You have pain. You have swelling. And the final one then is the loss of function because of those things. So, and loss of function is important because, let's say that you break a wrist or break an ankle, break a leg. A loss of function, making sure that your body is not stepping on or continuing to use that is important for the healing process, so that you don't continue to re-break or re-wound the area as it is trying to heal. So that those examples are very localized, acute inflammation that can take anywhere from 2 to 6 weeks to really go through the complete process of inflammation. So with that being said, if that's a natural, normal cycle in the body, doesn't it make sense that we should allow inflammation to take its course?
Yeah, and that is the problem where your original question of, well, should I just take an anti-inflammatory every day? And this is the problem. So yes, one of the things we mentioned was inflammation causes pain. So it is uncomfortable. If you break something, you sprain something, you bash your toe off the bed frame, we all do that. Yeah, it hurts. It's painful. And so it can seem instinctually, okay, well, I'm going to take something that's going to bring that inflammation down and it's going to make me feel better. It's going to take the pain away. But if you're bringing that inflammation down, you're also taking away part of, again, your body's natural healing ability. So that inflammation is bringing, it's basically the start of the immune process. And so what it's going to do is it's going to help prevent infection. So if you have, especially if you're talking about an open wound, you want that inflammation there because that's going to prevent stuff from the outside getting into your bloodstream and infecting you. So there's a lot of good that inflammation's doing. And not to say that, again, I understand in extreme circumstances, we're not saying that painkillers aren't necessary, but, post-surgery and things like that, of course, it's like you would be in agony if you're dealing with some major things. Yeah. But popping an anti-inflammatory for every small bump, bruise, scrape is, again, going to become an issue. It's not letting your body naturally do what it is intending to do. And it's not, it's not necessarily, it might make you feel better in the short run, but it's not necessarily helping you or your body in the long run. Yeah,
instant gratification, right? And so much of, what's wrong with our society is that instant gratification. Yeah. Hey, I want to feel better now so I can go do what I want to do. I drank, 6 beers last night. I'm not saying I did. I'm giving an example now, okay? But yeah, you got the old college, I drank 6 or 12 beers last night, so I wake up, I got a pounding headache, but I got to get to the football game, so I'm going to pop a couple Advil, a couple Tylenol, and I'm going to be on my way. So,
and even you brought up a good point too, where the inflammation, that pain is also your body telling you that I need time to rest and recover. So you think about me again, for me as an athlete with training, there's their idea of, with athletes popping pain pills so that they can get back to training. Well, yes, there's being tough to an extent, and then there's exasperating injuries and that you're going to prolong them. So by popping a bunch of pills so that you can get right back to doing what you're doing and continuing to hurt that and not letting your body rest and heal and recover, again, not the right approach. It might be, and I get in certain sports, and especially professional sports, you might not have the luxury of taking that time off. But for, again, average, Joe Schmo, it's like if you listen,
play pickleball.
Don't pop a bunch of Advil so that you can get back on the pickleball court. Let that injury heal, rest, recover naturally, so that you can get back to it in full capacity later, as opposed to maybe exasperating and causing more of a chronic issue by working through it and pushing too much.
And that's such a good point. And please understand that, there is significant data out there showing that people who you take an anti-inflammatory medication, for something as simple as a tendinopathy, okay? You have, let's say, like a golfer's elbow, tennis elbow, okay? And so you've got, basically some inflammation of the ligaments and, tendinitis on the inside of that elbow. If you take consistently an anti-inflammatory while that is painful, most people will say, hey, it's feeling better, I'm ready to go back out. But what they found is that you actually extend your body's healing time, okay? It's a longer healing process because you are literally contradicting what your body is trying to do. So it might be a little bit uncomfortable to not take the anti-inflammatory, but you are doing your body, you're working with your body rather than against your body when you are trying to recover from that localized inflammation. I mean, I even go to something as simple as, DOMS, right? Delayed onset muscle soreness. That is a localized inflammation because when you work out, when you lift, you are literally breaking down the muscle tissue. You are tearing down the muscle tissue. And so the next day or two, sometimes 3 or 4 or a week, depending on how hard you work out. But that delayed onset muscle soreness is a localized inflammation. Now, again, you mentioned athletes. I think athletes are some of the worst, when it comes to getting healthy and staying healthy. And again, I understand when you're at a peak performance and you're in competition like that, that could be the difference of, several $100,000 paycheck. Yeah. I get that. But when we're talking about, average population here, that muscle soreness, it's not a bad thing. That is your body responding and recovering to the workout that you did to break down that tissue. And what's going to happen is that it's going to grow back stronger and healthier.
If you let it.
If you let it.
Yeah.
If you let it. So, so important to understand. I'm sitting here stretching. Angela's looking at me like, what the heck is he doing? I'm stretching because, my son and I worked out real hard last night. So again, I'm feeling that soreness. And again, for someone who, if you're the type of person who enjoys working out, how rewarding, it's uncomfortable, but how rewarding it feels to be sore the next couple of days because that what you did is very productive. And as your body is recovering from that soreness, that localized, inflammation, it is getting stronger because it's repairing and growing back even stronger. So working with your body rather than against your body. So that, again, taking that medication, again, you have to understand that, maybe, there are times when, you have to function, you've got a big presentation at work and you've got a headache. You woke up with a headache because you had a couple drinks the night before, you're dehydrated or whatever, and you've got to perform. But, so episodically, doing that in a crunch, okay, we get it. We understand you're trying to, get through that, specific episode to function. But there are people who do that on a daily basis, get up and pop 5, 10, over-the-counter anti-inflammatories and think that they're, they're functioning.
Yeah.
but they're killing their liver and the kidneys in the process, right? So let's talk about, well, why would my body be inflamed? Why would I wake up with a headache, consistently? Or why would, my stomach hurt after I eat? Or why am I getting, these signs of like a, inflammation body wide, and they're happening day in and day out without any sign of relief? And the only way I feel like I can function is with an anti-inflammatory. Can you talk to that a little bit, Angela?
Yeah. So we talk again, when we were talking about the acute inflammation, we know that's, injury, illness, things like that come on very suddenly and our body responding to it. But when we're talking about chronic inflammation, and we specifically said low grade, and what that means is it might not necessarily be, you sprain your ankle, your whole ankle swells up. You can see it. It's very, very obvious. But what's systemic low-grade inflammation is pretty much this body-wide inflammation throughout. And now there are signs and symptoms of this, but a lot of the times, again, we just get used to it. So if, Dr. Dan mentioned headaches and gut issues, if you have skin issues, that's a big one. So a lot of eczema, rosacea, acne, those kind of things, a lot of that is coming from puffy eyes. Like Dr. Dan pointed at his eyes when he said puffy.
I hope we're not puffy.
But yeah, it's just so things like that are big signs of inflammation. And a lot of that is coming from our lifestyle. So we talk about, this chronic state of stress. And just like inflammation, stress is good and bad. And we'll talk about all of that in another podcast in more detail. But what you really want to understand is when it comes to that inflammation, it's coming from something in your lifestyle. So if you are, again, we talked about in a recent podcast, listening to your body, and that our bodies are very, very good at warning us and are good at telling us. So if you are putting something in your body that is causing inflammation, it's going to tell you in some way. If it's coming from your diet, you're probably going to get the gut issues. You might be getting the headache. You might be getting the skin issues. If it's coming from a lack of activity or too much activity or the wrong type of activity, if it's coming from chronic stress, emotional and mental stress, if you're not taking care of that emotional part, there's all kinds of things that can build up and cause that chronic state of stress and inflammation in the body, which is creating essentially the environment, like Dr. Dan was saying, back to that analogy, it is creating that toxic environment where you're going to be prone to that forest fire, where you're basically in that elevated state of inflammation all the time. So the smallest match is going to set it off.
Yeah, that's exactly right. I mean, like you said, you're basically dumping gasoline on, all over your vegetation, your lighting. And so now what should have been your, slow controlled burn, and you see this in especially elderly population that they've got the bruises all over them all the time, right? Mm-hmm. Because usually that's because they're on a blood thinner. But what do blood thinners do? They interfere with the inflammation process because they're interfering with clotting. Clotting is a part of that inflammatory in the inflammatory process and part of healing. So when you're on a medication that's trying to prevent or slow down the clotting process, then every little bump or bruise, every little bump or scratch, you end up getting a bruise because your vessels they're breaking open, and they literally you're seeing the bruising because of that. And then it doesn't just take a normal 2 weeks to recover from that. Those bruises are taking months to recover if they ever do. So when you have this this environment that your body is inflamed, and you've got the gasoline that's just all over everywhere, every little bump, bruise, twist, bend, pop, eating something, that gets through the gut, causes inflammation in the gut. So we're just setting up these environments to create this chronic system-wide inflammation, so that now when you do actually have an injury, it doesn't just take 2 to 6 weeks, acute and quick and healthy inflammation response to recover. It takes months to recover if you ever do, right? diabetic neuropathy and diabetic wounds are one thing that comes to mind. Now that's the severity at the end of the illness, but what happens with that?
Yeah, I mean, essentially, again, it's you're getting to the point that you're so inflamed, you have all of these issues, the nerves are literally dying. That's why you see the wounds. Checking the feet is so important so that you don't have to end up with amputation or blindness from the nerves to the eyes going. I mean, it's very, very damaging to have that low grade inflammation for long periods of time. In fact, it is the underlying cause of all of the major chronic conditions that are plaguing this country. So, we're not just talking heart disease, we're talking diabetes, we're talking, high blood pressure, cancer, all of these things are thriving in that environment of inflammation. And that is the key to understanding where I don't care what disease you are talking about, even just, even viral and bacterial infections. Again, your immune system is not going to function as much if you're in that heightened state of inflammation all the time. So having that taken care of, living that healthy lifestyle is also going to give your body not just injuries, but it's going to give your body the chance to fight off infections, because that same inflammatory process happens during an infection. Yeah. Your body swarms to that site of infection. Again, the inflammation is an important part of that immune response. But if your body's already inflamed and is already kind of in hyperdrive, if you feel like you're one of those people that gets sick every little thing. I used to be that way. I mean, I used to be the ibuprofen popping. I was chronic pain, chronic stress, chronically ill. I mean, it's just, and again, I didn't realize at the time how much of it was because of what I was doing to my body on a day-to-day basis. And it's just, it's night and day when you can see. I tell my clients this all the time, is you sometimes don't realize how sick you are until you get healthy. Yeah. And then all of a sudden you're like, wow, these things I was dealing, it's not normal to have a headache every day. It's not normal to be in pain every day. It's not normal to feel like just my skin is itchy and inflamed and my eyes are puffy. Yeah, the acne is a big one.
Yeah,
big
one. We both had bad acne growing up.
Oh, yeah.
And, again, we look back on, how much milk we drank.
Oh, my God, the lean pockets, the processed foods, well, no, they were lean pockets. They were healthy. That's a whole nother.
That's another podcast. The Lean Pocket Podcast.
Yeah.
Anyway.
But yeah, we thought we were living a healthy lifestyle because that was unfortunately.
That's what the experts told us.
That was a different
podcast.
That was our last one. Go back and listen to the
Trust
experts.
So what are some things? So I just mentioned milk. I just kind of threw it out there. But what are some things that would cause, because I know our audience is always, and again, you can just Google, anti-inflammatory diet. And again, I can't stand that term anti-inflammation, because again, you're going against what your body is naturally trying to do. Just like I can't stand the term anti-aging. I don't like that term.
We are all aging.
We are all aging.
All the time.
It's about, are you aging gracefully? Are you aging appropriately? Are you on an accelerated aging process? Mm-hmm. And that's what we see so many times, where someone in their 20s or 30s is the same physiology or biology as someone in their 40s or 50s or beyond. And we see it all the time. So again, when we say we're going to reverse the effects of the aging process, I'm not going to take someone back to 20. What I want them to do is put them on an appropriate, graceful aging pathway so that they're aging appropriately for their physiology, not accelerating it, so that we end up, right? You have the person who dies in their 50s or 60s, which again, that was the life expectancy, several decades ago when our grandparents were born. But you look, even if you look biblically, there are people who lived, we were designed to live well into our hundreds, as long as you survived any sort of nasty illness. As long as you survived that, we were designed to live. Our genetics have told us that we're designed to live well into our hundreds.
Yeah, you still see that in areas where they're not exposed to all the things that we're about to talk about.
Yeah, exactly. Blue zones. I don't know if I think you've done a little bit of research on that, but one documentary that comes to mind is the Okinawa Way. That is actually, I think it's on Netflix, but the Okinawa Way, and it talks about in Okinawa, that is, I think, one of these zones that has the highest concentration of centenarians, people who are 100 and over, the highest concentration of centenarians in their population compared to worldwide. And there are certain zones across the world that have these high pockets of centenarians. So again, we talked about observation in a different podcast and science and data. It's like, there's not randomized controlled trials for this, but it's like
they're doing something right.
They're doing something right because they're living healthily. It's not that they're in the hospital on their deathbed living past 100. No, they are involved in a community and living very, very healthfully as part of that community. So what are some things that people need to watch out for that would cause this body-wide, this chronic low-grade inflammation, that we can do about, right? Because we're not a victim here. We can do something about this.
Absolutely. Well, and one of my favorite things to talk about, which is sugars. So
oh boy,
it's pretty much the answer to all the questions.
So I'm going to be quiet now. She's going to talk for the next hour and a half.
If you think about it, so we were talking about inflammation is your body's natural response to fight foreign invaders. So what it really comes down to is anything foreign that you are putting into your body is going to fight that off. So when you're talking about what I call the SAD diet, so the standard American diet, which is highly processed foods, lots of sugar, lots of refined grains, unfortunately, we have come so far from what our body actually knows and recognizes as food, and we are now eating things that are mostly sugar, processed ingredients, artificial ingredients, and it's truly causing this chronic state of inflammation. So you mentioned the dairy. We're not designed to have dairy past the point of infancy. And we're the only mammal, we talk about this all the time, we're the only mammals that do that, and especially do it from another animal.
Right?
And so it's just this whole idea where, again, because we evolved to the point that we evolved to the point that we could be hunters and gatherers, and we figured out ways to do this, but by kind of domesticating animals in that way. And now, again, we don't go out and hunt. We stick a bunch of animals in, these packed farms. We pump them full of, antibiotics and growth hormones and feed them unhealthy, unnatural diets. And then we eat that meat and we wonder why we're getting sick. So, even unfortunately anymore, things that should be healthy because of the way that they're raised and they're processed are causing us, vegetables raised with tons of pesticides and loaded up with, again, just, they actually, you'll put things in them to make them look prettier and last longer on the shelves. But unfortunately, that diminishes the nutritional value. So a piece of fruit, so take an apple, for instance, apples now are much bigger, much higher sugar content, but much lower nutritional value than they used to be. Yeah. So, and again, if you went to another country where everything's still just actually natural and they go out and just pick them off the trees, very, very different. So unfortunately, it's just, we've done this to ourselves. And again, we didn't know what we were doing at the time, and we took the convenience, which is obviously wonderful. I mean, again, it did so much for us. It allowed us to be away from the home, it allowed us to travel and go and get out. But unfortunately, we kind of went very extreme, and now it's really that time to recognize it and realize that, convenience, it's great. We all enjoy it. We all fall victim to it at times, but it really comes down to, like you said, you're either going to be a victim of that convenience or you're going to have to put the time into your health. And the diet is going to be the number one thing. Activity is also going to play a role, but it's really what we're putting into our bodies. And then unfortunately, something else that we can't really control is just environmental things that we're exposed to. So air quality is getting poorer, water quality. Pittsburgh is, at one point, I don't know if it still is, but was second worst to Flint, Michigan as far as water quality. So if you're sitting there drinking the tap water every day, you're being exposed to massive amounts of chemicals. And again, water, something that's good for us, something that we need. You think you're doing yourself good by drinking lots of water. So unfortunately it's just one of those things where even if you think you're doing everything right, depending on the quality of what you're really eating, and unfortunately, the quality of what's available anymore is just very, very poor. And it takes a lot of deliberation to make sure that you're doing the research, you're getting the things that have the right nutrients and as few of those sort of outside chemicals as possible. And the sugar is just added to everything now, and it's just, we talked about insulin and that whole that was a whole nother podcast, so go back and listen to how sugar impacts all of that. But that same thing with it, it's just very, very inflammatory. Your body responds to it, and we're just in that chronic heightened state of inflammation. And if we clean up the diet, it again can't necessarily control where you live, can't necessarily control your some of these other environmental things, but you can control what you put in your body on a day-to-day basis and moving your body on a day-to-day basis.
One of my favorite sayings is, what gets measured gets changed. And I think the importance of, recognizing what we're putting into our systems. And so I guess I'm trying to, make this a little bit of a statement, but also kind of ask you the question, when someone sits down with you and they're trying to, they know they need to change something. They're at the point that, okay, I know that some things that I'm doing are wrong, and I want to change them because I want to live a healthier lifestyle. What resources or what do you, where do you start in terms of, okay, here's where maybe we can eliminate certain things, here we can add certain things. How do you take someone through that process and being able to clean up that chronic, systematic inflammation? Yeah,
absolutely. So I love an elimination diet. They take dedication if you're going to do it correctly and you're going to do it the full amount, but that's one of the best things you can do, especially if you think your diet is the culprit. So if you're having those very specific symptoms that we were talking about, generally I can look at a food log and pinpoint for you, at least, with a certain amount of, okay, it's probably one of maybe these three. Okay, you're doing a lot of dairy or you're doing a lot of sugar. And so I might even just have them start with just, okay, why don't you just try cutting that out? And it is amazing the amount of people that come back, especially with the sugar. Sugar is always going to be the one because there's no nutritional value to it. There's no reason that it needs to be in the diet. And it's amazing the amount of people that come back. Like I had no idea how much brain fog I was really having until it went away, or I didn't realize how low my energy was until I cut that out and cleaned that up. And so that's the idea of an elimination diet, is cutting out the things that we know are inflammatory, the sugar, the dairy, the processed foods, things like that, eating kind of a whole food diet, which is what I recommend on a regular basis anyway. But then you can kind of slowly add back in and see one at a time and see if something is that true inflammatory. In fact, I had someone the other day saying how she's kind of going through that process and she doesn't generally do dairy and had yogurt the one night, and her rosacea the next day she said she felt like her face was on fire. And just like that immediate, and those are the kind of warning signs that our bodies tell us. We just have to learn to listen to them instead of just saying, oh, well, I just have rosacea, there's nothing I can do about it. So she was able to identify dairy was a very triggering inflammatory agent for her. So, okay, you just have to, and again, I'm not gonna tell you not to eat it. I have people that are like, I can't cut out cheese. I just can't do it. It's like, well, then you accept the cons. I'm telling you, it's like, then you accept that. That's absolutely. It's your body. It's, you can choose what to put in it, but it's just recognizing that, okay, well, what dairy can you cut out? Then maybe we can cut it down, if not out, and making those changes.
Well, and I think that's so important that, rather than, a lot of times in medicine, right? You are, this is the way, and this is the plan. This is the treatment plan. This is the intervention. Do this, or you're just a puppet, right? You're just you're literally the lab rat, and they're going to be injected with things. You're going to have things taken out of the body. You're going to you are the victim, the puppet to drugs and surgery, which is the toolbox of medicine. rather than looking at a facilitative approach, right? We're much more, we always talk about, education is at our core, right? In terms of helping people understand the why behind we do things. And then again, once you have that information, what you do with it is now up to you. And I can tell you from personal experience, if I eat too much sugar, and again, we know from our parents, we got sweet tooths from both sides. And, I do. I enjoy, a piece of candy now and again, sometimes a handful of candy, and it gets a little out of control. But so beginning of the year here in January, I eliminated all sugar from my diet. And, and I did that for basically 2 straight weeks. And then I had a little bit of a day of, I'm going to have a little handful of this. And the next day I had a massive headache and I had neck pain that just right at the base of the neck into my shoulder blade. And I can't tell you the number of people that come in that have this, this neck pain, right at the crux of where the neck meets the shoulder blade and, where the trapezius muscle is in the back there. And, they're constantly sore there. And it comes to the sugar and a lot of times the artificial, then flavoring, coloring that's in there as well, the artificial crap that's in there as well. It's like that stuff has to go somewhere. And if your liver, you're talking about the low-grade inflammation, your liver is responsible for cleaning a lot of that stuff up. And if you're already at a heightened state of inflammation and now you add that to it, it's just like it never goes away. So you're absolutely right. It's just helping people understand, like, this is why we talk about it. This is how it's going to help you get healthy and stay healthy. And some people don't want to, make that change. Or some people, they're not ready to make massive changes. But that, you're right, that elimination really helps as you start adding things back in. Another example, I had a woman who came in and she reported to me that she went gluten-free for a while. Well, again, the problem when you go completely gluten-free is that what she replaced it with was soy and rice. She realized that over the course of a year, she had gained like 10 pounds back after she was doing really good. And she was having like all of this shoulder pain. She took rice out of her diet. Shoulder pain gone.
Interesting.
Okay. So, again, sometimes we're starting with one process, you're making a change, but you still have to measure, you still have to monitor, and you have to see how it's impacting your system because, the changes you make initially may not necessarily, you start, improving your health and well-being and you start getting better function. Those same changes may not continue you down the path, right? You talk about this concept of plateauing, which is so evident in weight loss, right? You don't just come down in a nice steady slope. Yeah. It's down, plateau, down, plateau. Maybe up a little bit. Up, down. And the same idea, when you're starting to achieve a higher level of health, you have this, these pauses where, your body is adapting to the new, to its new state. And again, hopefully a healthier state, but ultimately it has to be there and get reset for a while before then you can continue down the path, right? It needs to rest at that new space.
Absolutely.
So.
And one of the best things you can do if you're starting to make those changes is journal. That's what I always advise people to do because, again, when you're talking about some of this stuff, yes, there are inflammatory markers you can test for. And if you're suffering from chronic conditions, I'm sure hopefully that is part of what's being tracked. But, if you're just kind of at that point where you're like, I don't feel quite right and I want to make some of these changes, those subjective observations, again, your observations on yourself and your health are really, that's going to be some of the best data that you can put together. So, we always talk about food logs. Again, I don't track calories. I don't track macros. I, generally know when I'm eating well and when I'm not. And if you're eating the right things, you don't necessarily, again, if you're the average person, if you're not training for some specific event, if you're the average person, if you're eating a generally balanced diet, you will know your weight will be stabilized. You'll generally have energy. You'll feel good. So, write down, just kind of jot down what you eat throughout the day, jot down how you feel. So, are you waking up energized or are you hitting the snooze button 6 times? Are you falling asleep easily or are you mind racing at night? Do you, any headaches, any gut issues, any, the skin issues? So track these things because it's sometimes if we don't actually be mindful to it. It's easy to just be like, oh, well, that's just the way. I'm just not a morning person. I'm not a morning person. Well, maybe you're not a morning person because you're in this chronic inflamed state and it's just physically difficult for your body to get up in the morning. So if you clean up some of that, you might sleep better and then have more energy in the morning. So some of these things that we've just accepted as, oh, that's just the way I am, might not have to be the way you are if you make those changes. So journaling, that's the best way, helps keep you on track too. Because it does, it gets, in the society we live in, it's difficult to live a perfectly clean lifestyle. Of course, again, we're social, we're a food is love kind of family. So there's not a single family gathering or social gathering that doesn't involve some kind of food. And we've gotten much better over the years of what that food is, but it's still, going out with friends, going out with family, of course you want to be able to enjoy those moments, but paying attention to how you feel. I just came back from a girls' weekend, and first thing I said when I went to the gym on Sunday night when I got home, and oh my God, I was like, nope. I felt it immediately. And those are the kind of things that you will recognize. The cleaner you are on a regular basis, the more obvious those warning signs will be, and the more you will become used to listening to them and knowing what works for you and what doesn't.
Well, again, so two important points with that is, number one, if you are chronically inflamed, that's the body warning you, right? Mm-hmm. And so, the problem is sometimes, and many times in our society, people have had that warning that they've had the fire alarm going off for so long.
They don't listen to it. They don't hear it.
Exactly.
So what's that?
Yeah, where they go and they take the batteries out of the detector. So number one, if you are that chronic inflammation, it is sometimes harder to hear those warning signs because you're not paying attention to them and you pass them off as, well, that's just my normal. Mm-hmm. Well, your normal may not necessarily be healthy. Mm-hmm. Having a bowel movement once or twice a week is not healthy. Having this, acne or rosacea on your skin or very dry, flaky skin, that's not healthy. Waking up and not feeling energized and just feeling very sluggish as you get out of bed, that's not healthy. Having a headache every day, that's not healthy. So, just because they're your normal or normal within your family or within your friends, that doesn't necessarily mean it's healthy function.
Exactly.
So that's point number one, that if you do have this chronic inflammation, you may have accepted these normal average warning signs as, you just brush them off. But the other thing then, to your example, when you are eating clean on a regular basis, when you do have this celebration now and again, see your body, because it's not chronically inflamed, now it can cycle through that inflammation much faster.
Might not feel good while it's doing it.
It might not feel good. Yeah. And this is not a case, you didn't come home Sunday night and pop a couple medications. You went to the gym, you suffered through it.
I fasted for 40 hours.
Fasted for 48 hours, and now we're a couple days later, and does your body feel better?
Oh yeah, I feel much better.
Yeah, so it's like, so that's the thing is, when you do have these celebrations and you go away for a long weekend, or you have a wedding, or if you go away for a week on vacation and celebrate a little too much, your body can recover much faster because you're not chronically in that inflamed siren warning signal state. So I think it's fantastic information. We might have to continue going through a couple more resources for information, to really help guide people. But, we had a couple really good points about journaling and, different, how inflammation is being processed in a healthy state versus a chronic state. And just, really trying to get that 30,000 foot view of, remembering that inflammation is a natural, normal process in the body. We don't necessarily need to be fighting it, but we can get to the bottom of why it's there and help your body get healthy and stay healthy. So with that being said, yes. I am Dr. Dan with this podcast episode of Inflammation Information.
I'm Angela Turo. If anything resonated with you, please always feel free to check out our website, which is Turo, Turo, familychiropractic.com. Lots of information on there. You can always reach out to us with specific questions. And if you're looking for, some help with your health and you're in the area, please reach out as far as how you can become a patient, we can welcome you into the Turo family, because we really are a family, right? Our patients are our family. We want to help you guys get healthy and stay healthy for life.
Absolutely. Thank you so much.
Thank you guys for listening.
Excited to see you next time.
You've been listening to What the Health with Dr. Dan and Angela Turo, brought to you by Turo Family Chiropractic. To learn more about the resources mentioned on today's show or listen to past episodes, visit www.whatthehealth.world.